Well, thank you for the opportunity to speak with you for the inaugural Melanoma and Skin Cancer Nurses Organisation Summit and to launch this report today. Connecting Nurses to Nurses, a model for best practice care of skin cancer in Australia. Before I begin, I want to acknowledge the traditional custodians of the land where I am in Canberra, the Ngunnawal people, and I pay my respects to elders past and present, the custodians of the lands and waterways of this region for tens of thousands of years. I extend that respect to the traditional owners of the land where you are today, the Turrbal and Yugara peoples who have lived in and around that region for more than 32,000 years. I also acknowledge any First Nations people joining us today. I am proud to be part of a government committed to the Uluru Statement from the heart in full: voice, treaty, truth. Firstly, I want to pay tribute to the work you do as melanoma and skin cancer nurses. Your organisation has done something wonderful by identifying a gap in the available resources and support for you and your colleagues. I know that the nurse education modules which you've developed have been in circulation for little over 9 months and have already been accessed by a wide group of nurses around Australia. Now, this is helping build a better community of practice and supporting nurses to improve patients' experience and care. Specialist knowledge, including of treatments, therapies and general support, coupled with first-hand experience supporting patients, is invaluable for patients and their entire treatment team. Melanoma and skin cancer nurses are able to provide not just care and clinical support, but psychological support to help patients come to terms with their diagnosis and their treatment. Nurses are on the front line of patient care. What you do is integral to caring for and supporting patients on their journey. So thank you. I was thrilled to be invited to launch the Connecting Nurses to Nurses, a model for best practice care of skin cancer in Australia report today. As a former nurse, I know that the network and the support which nurses build around themselves and between each other are incredibly strong. It's one of the reasons the Australian Nurses and Midwifery Federation is the country's largest union. We see the value in supporting each other. Now, this report is of course more about connecting nurses to share expertise, best practice and to improve care for people with skin cancer. The report will give us valuable insights into the opportunities available to improve the patient experience and expand and nurture the nursing workforce in Australia. Empowering melanoma and skin cancer nurses to provide education and knowledge sharing with their generalist colleagues builds the kind of supportive and skilled foundation we need. A bedrock of knowledge will enable more support for skin cancer patients. The cohort of melanoma and skin cancer nurses is not a large one, which is why sharing their experience and building a foundation of knowledge will have far-reaching benefits. We know that despite campaigns to protect our skin, despite regulatory action in the past on things like tanning beds, and despite better diagnostic work from primary care professionals, Australia's skin cancer rates continue to grow. Now, while we can be proud of our increasing survival rates, thanks in part to early diagnosis through skin checks and better treatments, we must acknowledge that skin cancer does put high demand on our health system. It is so often our nurses, just like you, who carry this burden. But your work does lead to improved health outcomes. I certainly commend everyone who's worked on this report and showing how connecting nurse to nurse shares not only the burden, but the opportunity to make a difference. Through training, mentoring, sharing knowledge and building a community of practice, these specialised skills can be better accessed by more patients who need them. I know the report will be studied in depth, and I'm sure that there are considerable learnings and a way ahead which can be taken from it. And it's so important that we continue to equip ourselves with the best teams and the best knowledge and the best care. Because as the poem goes, we love a sunburnt country. It's part of our identity. Summers spent by the beach, a day's hard work on the farm or a long bushwalk. I hardly need to remind any of you that the impact of our sun obsession can be deadly. The statistics speak for themselves. Melanoma and skin cancer will affect 2 out of every 3 people in Australia in their lifetime. We know that early detection and prevention are critical, and that's why we must all continue to advocate and spread the message to get skin checks regularly. I myself recently had a skin check right here in Parliament House with the team from MScan, and I was so grateful to have that reminder, as well as the opportunity to pass the message on to others. Our government has invested $10 million in a 2-year national skin cancer prevention campaign, which is being delivered in partnership with Cancer Council Australia. So we continue to increase awareness and ultimately prevent more cancers. We know that melanoma has a significant impact on Australians, for patients as well as their families and friends. The government is also considering how we can improve access to cancer care for all Australians, regardless of their tumour type, through the Australian Cancer Plan. The plan is being developed by Cancer Australia. It will set out priorities to improve cancer outcomes in Australia over the next 2, 5 and 10 years, covering the entire cancer continuum. It's been my pleasure to be able to speak to you at the opening of this summit. I wish you all the best for the coming discussions and at the upcoming Australasian Melanoma Conference. You have such a contribution to make to the way we address skin cancer and melanoma in Australia and into the future.